They used to call it the disease of kings, but trust me, you do not need a crown to suffer from one of its attacks. Today, we're going to talk about gout, an ancient disease that's actually making a huge comeback. So let's dive right in and figure out what's behind these incredibly painful crystal attacks.
So picture this, you go to bed feeling totally fine, and then bam, you're jolted awake in the middle of the night by this searing, throbbing pain in your big toe. It's red, it's hot, it's swollen, and it's so sensitive that even the weight of a bedsheet feels absolutely unbearable. So what's the culprit behind this brutal, out-of-nowhere assault? Well, you guessed it, it's gout.
Okay, so to really get a handle on this, here's what we're going to cover. First, we'll look at the crystal attack itself. Then we'll dig into the causes and risk factors. After that, we'll see how the body responds with inflammation. Then we'll cover symptoms and diagnosis. And finally, wrap up with treatment and management. Let's get started. All right, first up, gout, the crystal attack. Now, here's the key thing to understand right from the get-go. Gout isn't really a joint problem, not at its core. It's actually a systemic issue, a disorder of how our bodies process these things called purines.
So, this whole metabolic process can lead to a condition called hyperuricemia. It sounds complicated, but let's break it down. Hyper just means high. Uric is for uric acid, and emia means in the blood. So, boom, it's just too much uric acid floating around in your bloodstream. Now, this is absolutely crucial. Hyperuricemia is the first step needed for gout. But, and this is a big but, just having high uric acid doesn't automatically mean you have gout. It just sets the stage.
So what's the next step? Well, this is where it gets nasty. When your blood gets totally saturated with this uric acid, it has nowhere else to go. So it starts to precipitate out and form these microscopic, razor-sharp needles. These are monosodium urate crystals, and they form right inside your joints. The best analogy? It's kind of like making rock candy from sugar water, except instead of a sweet treat, you get these tiny, vicious weapons that are about to trigger a massive inflammatory battle. And that battle is what we call a gout attack.
Okay, so that naturally leads to the big question. Why do uric acid levels get so high to begin with? It really comes down to a simple supply and demand problem, or maybe more like an in versus out problem. Either your body is making way too much uric acid, or your kidneys just aren't getting rid of it fast enough.
Let's think about this like a balancing act. On one side, you've got things that pile on the uric acid. A diet that's high in purines, we're talking red meat, certain seafood, that's just giving your body the raw materials to make more. Then you've got alcohol, which is like this double agent. It ramps up production and it tells your kidneys to slack off on cleanup duty. Then on the other side, you have things that mess with your body's ability to get rid of it, like chronic kidney disease or certain meds. And kind of overseeing this whole mess is obesity, which can throw that entire metabolic balance out of whack. So we've got these sharp little crystals just hanging out in the joint. But how does that turn into such explosive, off-the-charts pain? Well, to figure that out, we need to zoom way in and take a look at the wild biological battle that's about to kick off. This is the pathophysiology of a gout attack. This whole thing is a fascinating and brutal chain reaction. The second those crystals show up, your immune system freaks out. It sees them as foreign invaders and sounds the alarm. That's the signal for a flood of immune cells, these little soldiers called neutrophils, to rush to the joint. They try their best to eat and destroy the crystals, but as they're fighting, they release this massive chemical storm. And the result? It's basically a case of friendly fire. Your body's own defense system is what causes all that swelling, that redness, and that just unbelievable pain of a gout flare. Okay, now what happens if this goes on for years and years? If gout isn't managed, all those little crystal deposits can start to build up and grow into these bigger, kind of chalky clumps. They're called tophi. And you can actually see them. They can form around the joints, right under the skin, sometimes even on your ears. They're literally a visible, physical signpost of the metabolic problem going on inside. So yeah, those tophi are a dead giveaway for chronic gout. But what about that very first agonizing attack? How do doctors figure out what's going on? Let's get into the symptoms and diagnosis, how to recognize the clinical picture.
You know, there's a textbook presentation for gout, one that practically screams its name. It's an attack right at the base of the big toe. It's so common and even has its own fancy name, podagra. So why the big toe? Well, it's probably because it's one of the coolest spots in your body, temperature-wise. And it turns out urate crystals form much more easily in cooler temps. You combine that with all the stress that joint takes every day, and, well, you've got the perfect storm for an attack. But to be 100% certain, doctors need to get eyes on the actual culprits, the crystals themselves. The gold standard for diagnosis is to take a tiny sample of fluid from that inflamed joint. Then they look at it under a special microscope with polarized light. And this is cool. The uric crystals have this signature look. They're bright, they're needle-shaped, and they're what we call negatively birefringent. That's just a fancy term for how they change color with the light. They look yellow when they're lined up one way and blue when they're turned the other. It's that specific color shifting that's the smoking gun. It's also why a simple blood test isn't enough. Believe it or not, uric acid levels can sometimes look totally normal during an attack. And if it's been going on for a while, an X-ray might even show these punched-out erosions where the tophi have actually started to eat away at the bone. Okay, so you've got the diagnosis. Now what? How do we fight back against these crystals? This brings us to our last section, treatment and management. And the strategy is really two-pronged. First, you have to put out the immediate raging fire of the attack. And second, you have to do long-term fire prevention to make sure it never happens again. When you're in the middle of an attack, the number one goal is just relief, and fast. We do that with some heavy-duty anti-inflammatory drugs. There's colchicine, which basically tells those neutrophil soldiers to stand down. There are NSAIDs like indomethacin, and also corticosteroids like prednisolone. All of these are great for calming that firestorm, but, and this is important, they don't do anything about the high uric acid that caused the fire in the first place.
And that's where long-term management is key. The goal here is to lower your uric acid levels for good. There are basically two ways to do this. Strategy 1, shut down the production factory. Drugs like allopurinol block the enzyme that actually makes uric acid. Strategy 2, open the floodgates. Meds like probenecid tell your kidneys to work overtime and get rid of more uric acid. The end game is to get those levels so low that not only do new crystals stop forming, but the old ones might even start to dissolve.
But of course, meds are only half the battle. Lifestyle changes are just as important. They're a crucial partner in managing gout. This means we have to go right back to those risk factors we talked about. We're talking about cutting back on alcohol, avoiding foods that are super high in purines, and keeping a healthy weight. It all works together to support your metabolism.
And look, this long-term plan is absolutely non-negotiable. Why? Because if you let gout run wild, it's not just about dealing with painful flares every now and then. Over time, it can cause permanent joint damage, lead to agonizing kidney stones, and even seriously damage your kidneys. So if there's one thing to take away from all this, it's that a gout attack is so much more than just a sore joint. Think of it like a flashing check engine light for your entire body's metabolic system. Managing it means committing to a long-term plan, a real partnership between you and your healthcare team. It truly is a marathon, not a sprint. By understanding exactly what's happening with these crystal attacks, maybe we can finally start to get the upper hand on this disease. Thanks so much for watching.